Okay, so today we're going to talk a little bit about total cholesterol, as I mentioned. And again, the basic makeup of the lipid panel is something that we often many of you are familiar with because you see it on both your semi-annual and annual labs. It consists of your triglycerides, total cholesterol, HDL, and LDL and HDL, and VLDL. And today we're going to talk about, again, total cholesterol, as I mentioned. Okay, so cholesterol. So your cholesterol, where is it created? Do you get it from diet, or is it primarily synthesized? Well, the answer to that is it's a mixture. Cholesterol is obtained from your diet. A small portion is about 10 to 20%. It is a misnomer to think that, cholesterol-rich foods contribute dramatically to your cholesterol panel. That's not necessarily the case. In fact, most of your cholesterol is synthesized in the liver. And individuals who have high cholesterol, many times it's not necessarily their diet that's causing, just cholesterol-rich foods within their diet that's causing the issue. It's other lifestyle factors or other factors within, in terms of activities or medications they may be taking that may be contributing to a higher cholesterol level. So let's go over here. Where exactly is cholesterol utilized in the body? Well, so it's not this terrible substance. It's actually very useful. It's utilized in hormone production. As you can see, it's a precursor to many different hormones in the body. Pregnenolone is an important neurosteroid. DHEA is important in terms of sex hormone synthesis. Cortisol, aldosterone in terms of salt and blood pressure regulation. The sex steroids, testosterone, estradiol, all of these are precursors of cholesterol. And if you don't get enough, or you don't make enough cholesterol, your hormone production will drop. It's a component of cellular membranes. So the outer wall of cell membranes has a large portion of it is created utilizing cholesterol. And that's also important in signal transduction. So like when hormones attach to hormone receptors, cholesterol is involved in that process. It's also involved in signal transduction. So like with nerve cells, maybe you guys remember this from biology, the dendrites are covered in myelin sheaths, which kind of acts as a conductor to speed up signal transduction between nerves, and cholesterol is a big contributor to the myelin sheath. So it actually promotes communication between neurons. And it's kind of interesting. There is some data to suggest that individuals who suffer from dementia, they have demyelination of their nerve cells, and therefore slowing in terms of their thought processes, and it may be secondary to decreased cholesterol. And we'll kind of get into this. There are some individuals that feel that the widespread use of statins, which basically decrease the total amount of cholesterol in your body, may be linked to dementia in certain individuals. So, and that might be one of the mechanisms of action. Okay. Cholesterol transport. So you've probably heard of HDL and LDL and VLDL. So everyone knows HDL is the good cholesterol and LDL is the bad cholesterol. Well, they're not exactly cholesterol. They are cholesterol transport proteins. HDL stands for high density lipoprotein. LDL stands for low density lipoprotein, and VLDL stands for very low density lipoprotein. And what these essentially do, well, HDL, and screen because it's good, is essentially the lipoprotein that transfers excess cholesterol from cells back to the liver. And that's a good thing, right? LDL, on the other hand, transfers cholesterol to cells. So you do need a certain amount, but excess amounts or having an LDL level that's too high is bad because more cholesterol is delivered to the cells, and cholesterol can be deposited in the vasculature and cause plaques, right? And then VLDL is extra bad because not only does it convert to LDL, but it contains triglycerides, which, as we mentioned, lead to increased amounts of fatty acids and increased adipose tissue, which long-term is pretty bad, right? And then once VLDL particles or transport proteins are depleted of their triglycerides, they are converted to LDL, and then they start giving off cholesterol to the cells. So of course, you do need a certain amount of LDL and VLDL carrier proteins, but you just don't want these to be in overabundance, because if you do, of course, you're going to have way too many fatty acids and
Don't you do it.
cholesterols. Okay. So let's go over here. Reference ranges for total cholesterol. So one number people might remember being thrown around is 150, right? So ideally you want a total cholesterol less than 150. These reference ranges, I think, are a little bit conservative. These are what, you might see you're in your PCP's office. They might be like, well, less than 200, you're fine. If you can keep your total cholesterol less than 150 milligrams per deciliter, your likelihood of suffering stroke, heart disease, kidney disease, anything related to vascular issues from cholesterol buildup is very, very low. So that's what I always try to get my patients towards, getting below 150. Okay, what are some of the causes of high cholesterol? So again, these are things that I try to always emphasize in terms of avoiding. So being overweight or obese certainly can lead to high cholesterol. So, watching your diet, ensuring that you have a optimum exercise regimen are going to make a big difference in terms of maintaining a healthy, lean weight. Excessive alcohol consumption. Again, I'm not super positive about alcohol, just because of the fact that it does really slow down your metabolism, but it is associated, of course, with the worsening lipid panel. Chronic stress, obviously that's not a good thing. Diets that are high in refined carbohydrates and sugars. So I'm a big fan of gluten-free carbohydrates, trying to ensure your carbohydrates are earlier in the day, and making sure that they are complex in nature, so they don't tend to increase your insulin levels and lead to absorption into adipose tissue. Insufficient exercise or lack of exercise, so that's obviously resistance training is key. And then finally, sex hormone imbalance, and that's obviously a key component of the clinic, trying to make sure your testosterone levels are optimized, thyroid, estradiol, etc. Now, what are the symptoms of high cholesterol? Well, there really are no symptoms per se of cholesterol, but they're more secondary to the disease processes that cholesterol leads to, like heart disease, stroke, and kidney disease. So obviously, you don't want those things to occur, but that's usually when you'll notice it. So it's important. I guess the key thing is it's important to screen your lipid panel, because you don't want to learn about high cholesterol when you're in the hospital suffering from a stroke, right? You want to learn about it when you're like, well, okay, hey, my lipid panel doesn't look good. Okay, and how can it be treated? Well, so the conventional physicians tend to go to these medications first. They're like, okay, your cholesterol is high, forget about your diet and exercise training. Here, take some Zetia or Lipitor. And so, or Questran. So the four main ones are bile acid sequestrants, like Questran or cholestyramine, which basically binds bile acid in the gut. Azathioprine, or Zetia, which essentially decreases cholesterol absorption. Niacin, which blanking on the mechanism of action for niacin. Oh, okay. It actually decreases hormone sensitive lipase, and so decreases the release of fatty acids into the bloodstream. And then the statins, which decrease a pretty important enzyme in cholesterol metabolism called HMG-CoA reductase. All of these medications they do work to a certain extent, but they all have pretty significant side effects. Almost as a whole, they tend to deplete essential nutrients. In particular, statins will deplete B12, B3, vitamin E, K, coenzyme Q10. And almost all of them are linked to nausea and vomiting, diarrhea. Statins are known for muscle aches and liver dysfunction. And so these are things that obviously are not desirable. So I try to avoid these medications when I can and prefer to do alternative therapies, such as diet. So again, I can't emphasize can't underemphasize the importance of diet. Just by changing your diet to a diet which is lower carb. You still need carbohydrates, but you're eating them earlier in the day. You're avoiding refined carbohydrates. So basically, carbohydrates that are complex in nature, that are not processed, things like yams, rice, brown rice, quinoa, oatmeal versus, cereal. Avoiding things that have saturated or trans fat. So I always emphasize eating lean proteins versus proteins that are high in saturated fat. Gluten and dairy, they tend to also worsen your cholesterol levels. Dairy is primarily from dairy that's high fat, like cheese. And then having a diet that's high in fiber seems to also help with reducing cholesterol levels. There are certain supplements that I'm a big fan of: coenzyme Q10, the omega-3, essential fatty acids, and probiotics and garlic extract can help too. Resistance training seems to help a whole bunch. So training in the gym, going to failure, and doing some form of cardio makes a big difference. And of course, hormonal optimization. TRT optimal levels of testosterone are associated with optimal HDL levels and decreased LDL levels. So those are good things. And then finally, something as simple as sleep. It seems pretty underrated, but it's actually pretty important to get 7 to 8 hours of sleep, and it really can make a big difference in terms of your panel if you're not doing that. Okay, so I kind of wanted to make this particular presentation shorter this time because I think last time I spent about 15 or 20 minutes on it. So that's pretty much it. Next time we'll talk about HDL and LDL in greater detail. But at this point, I think I'm just going to kind of open up the group to any questions. And again, these are any questions, anything could be anything in general, about not just about your lipid profile. So does anyone have?
I actually have a question to start off.
Sure.
Why do we see a lot of primary care doctors like just give like a